So our yeah. So our next speaker that we have today is Barbara Campbell, and I am going to let her introduce herself. And as with all the speakers, their bios, extended bios, are in your handout. But we're grateful to have Barbara here, and thank you.
All right. Thank you so much for having me. I'm really glad to be here in person. I was telling Dr. Higgins, and I thank him for hosting me and taking good care of me. And I always love being in person. I'm so happy that COVID has evolved to where we can get together and see everybody again. I was thinking, I was getting to hear a lot of Dr. Higgins' stories this weekend, and I think everybody in this room has a story for why we're here and why we're involved in Haiti. And just quickly, my background before I get into this. And I literally, by an act of God, found myself in Haiti a week or so after the 2010 earthquake, not with any surgical skill or any skill that was really needed in Haiti at the time. But it was obviously a life-changing event. And I think what happened to me that trip, a lot of things happened, but my heart broke for the Haitian healthcare professional. I mean, I was a pharmacist, which you totally did not need in Haiti after the earthquake, by the way. But there I was. But I was meeting my peers. I was meeting physicians. I was meeting pharmacists. I was meeting nurses that had their house destroyed, that had relatives die, that I'd got to know in their education background. And my heart literally broke for how challenging their life was. And that began a huge life change for me and my family. We ended up uh, working full time for a large mission organization in Titayen, Haiti for quite a few years. And again, my passion continued to grow for helping the Haitian healthcare professional. That's always been in my mind. And as I was there working and supporting them, they were doing all the hard work. Um, the siloing thing just really got to me. I know that people have touched on that before. Everyone working so hard in a silo, what can happen if we do start to collaborate? Can we do anything? Can we have impact? Can we provide encouragement? And that's where I met Mr. Dalton. The Dalton Foundation was one of our funders. And he had that same vision too for how do we start connecting what's going on? Because there's incredible work going on. And another thing that Dr. Kaplan said that's always touched us too is what's already happening. And we sometimes come up with the ideas, oh, I want to do this. I know a particular example for us, and we wanted to add X-ray to our mission. Well, I learned that there was two other facilities like within, I could almost throw a rock and hit them that already had it. So why should we do it if they already had it? So these seeds were being formed in me of how can we do this more efficiently? And then in late 2017, I had the opportunity to go work for the Dalton Foundation full time. So we left Haiti and we moved to Cleveland, Ohio. And the Dalton Foundation, I always tell a funny story about that. When we were in Texas and we told our friends and family that we were going to move and work to Haiti, they kind of sit you down and they think, you're a little crazy. Are you sure you know what you're doing? But let me tell you, when you tell people you're moving to Cleveland, Ohio, they're very convinced you've lost your mind. But I will say we love Cleveland, and it's been a great place for us. It's very underrated, but anyway, not here to talk about Cleveland. But when I got to Ohio, we do a lot in Ohio too, which I'm not going to talk about. But the task of starting this vision or this dream we had for collaborating healthcare in Haiti, I was like, well, where do we start? Before I came, we had hosted a few meetings in Port-au-Prince, at the Marriott, where we'd bring in Haitian healthcare professionals. We just really wanted to love on them, take care of them, encourage them, provide education, and how do we expand this? And so I started looking and searching for anybody in Haiti that was collaborating already. And that's where I came across Dr. Kaplan, and who we just heard from, and a lot of others as well. But I thought it was really important, as I said, to find out who's already doing this. I met Kay, who spoke first, learning about the work they're doing with infant care and midwifery, and I've got to meet Jane, like everyone on there. I'm like, I know them. So it's been really great to do that, and that's how we started. And then we were able to host some conferences, both in Cap Haitian. We were able to host more in Port-au-Prince until in 2019, everything kind of changed for all of us, right? And that's kind of where I'm going to pick up the story a little bit about who we are. Let's see if I can make the slides work okay. Maybe. Okay. So I shared a little bit about the problem, but everybody working kind of in silos, everybody working really hard, not enough resources to get everything done, just donations, everything being disjointed and disorganized. And how can we, or can we, even it was even just a question, can we help people get more organized um, to create impact and have effect? I mean, we definitely believed we could, and that's definitely the motto of the Dalton Foundation, is together we can. All the work we do is to help collaborate. I'm going to share a little bit about kind of the process of how we work. And this is a process that we follow, whether we're working in Haiti, whether we're doing projects in Africa, or whether we're in Ohio. And Dr. Kaplan touched on this too. It's what we call understand the landscape, or mapping, or if you're a business person, understanding the marketplace. And that's just who is already doing something. Because if it's already being done, we need to amplify it, highlight it, support it before we start something new. And I'm going to go into a little bit about what we did on that in Haiti. And then we're really big on bringing people together. I give kudos to Janice and team for putting this together every year for 10 years. I have a great appreciation for how difficult it is and all the challenges involved, but it's so important. I think it's important for people to get together, to share ideas and encourage each other and learn from each other. It gives us energy to carry on the work we're doing. So we're very passionate about that. And then the last thing we do, we view this mapping work, this connecting work, it forms a really strong backbone by which we're able to strategize and implement some strategic projects. And so I'm going to go through a little bit of how we did this with the Haiti Health Network. All right, so the very first thing we did in Haiti when we started this, besides reaching out to people like Dr. Kaplan and others in Haiti that were collaborating, was map the country. So we took what Dr. Kaplan had started. He had a small but mighty team in Haiti, and we kind of adopted and merged with them, and we started mapping healthcare in Haiti. We did this in partnership with the Ministry of Health, as you would have to do this in a case, and I'm going to go through a little bit about how we did that too. But this database is online and it is free. It's called relinkglobalhealth.org. And you can search for healthcare facilities throughout Haiti. You can search for equipment throughout Haiti if you're looking for where is a C-arm, where is the closest x-ray, where's the closest mental health service, where's the closest dentist, you name it. We've got this database and it's publicly available. So we just encourage everybody to use it. And then there's a lot of behind the scenes data that we're able to track and the team gathered that we use for grant writing and we use to give to other organizations that are writing grants. I'll go into a little bit more of that going forward. Here's a little bit of summation from 5 of the departments of the data. We do have data completed on 9 of the 10 departments. The only department that we haven't finalized is the West Department, and that's because we weren't finished with it before we weren't able to go there anymore. But these are all the facilities that we have data on. Our team literally went to every facility. We funded them to go. They met with the Ministry of Health before they went, and they went to every single facility. They not only got location data, geotagging, and services data that they offered, but we had them measure capacity data. And this is my favorite because it's actually measuring what their actual capacity is to deliver healthcare. A lot of times there's a building in Haiti and maybe there's a nurse there, but there's no physician there, or the physician comes once a week. They don't have any stethoscopes on hand. They don't even have electricity but a couple days a week. So their actual ability to take care of patients is drastically reduced. It's counted in a country number, healthcare facility here, but they don't really have a lot of capacity. So we're able to show capacity. That data, by the way, is not available publicly that you can see on that website I just mentioned, but we do have it and we share it with organizations. I've got all kinds of data reports that we share about this data. We also print directories. When we go into a department to do projects, we download the data from that department and we put it into a directory. It's in Creole, but a lot of the words are in English as well. And we distribute that out. And that's just our goal, to help people really understand who their neighbors are. Again, I'm always amazed when we get a group together in Haiti and they don't know each other. And I mean, that happens here too. But it's a way to help them know their neighbors and to reach out if they need help for a service they don't offer. So we provide those printed directories as well when we go into a given department to do our projects. So that's a little bit about how we do mapping or how we understand the landscape before we go in and start doing work. And while we were doing all that work, we were still very passionate about education and collaboration. We did get to host a few meetings. We experimented with doing some things. Do we do English? Do we do Creole? Do we do French? All these different topics have been debated and discussed, and we still don't have it perfected yet. We're still working on all that, but we're able to host a lot of different meetings before 2019. And then, of course, with 2019, with the initial fuel crisis that how it all started, and then we led to COVID, we had to move to pretty much all online. Today, we're hosting twice monthly what we call general roundtable discussion meetings, and we have several members of the Haiti Health Network in here who participate. We welcome everyone to participate. You don't have to run a healthcare facility to participate, but we will say the topics usually center around healthcare. Lately, of course, the topics are centering around survival and what are people doing. We share resources, we connect people together. You know, someone will say, I'm doing this and this. Oh, can you connect me with her? I need to know how they did that. And so we do a lot of connecting at those meetings. And so we have those on the third Wednesday at 12:30 in the middle of the day. And then we have them on the first Tuesday at 6:30 at night. So we try to do some during the day and then some for at night when people can't be available. And those are in English. We have our team now. I've been really blessed to add a few people to our team, particularly Rachel. For those of you that have gotten to deal with Rachel, you know she's amazing. And she speaks very fluent Creole and is allowing us to now expand some of our meetings into Creole that we can lead from the US. You know, there's always an internet challenge. Sometimes when we lead things from Haiti, it's not as stable. So if we can lead it from here and then get everyone to join in, it's great. And then Rachel also leads a lot of WhatsApp groups in Creole, which is also very helpful for, we have a WhatsApp group for each department, and it's a way we can kind of connect with healthcare professionals pretty quickly. And that's been great. And then this year we started some working groups, and Dr. Higgins and I will share a little bit about the advocacy one, but this is one, Dr. Higgins and I will get fired up pretty quick on this topic. But we have to let people know what's going on in Haiti. Like, we've all seen it. We're all struggling. We feel very passionate to be a voice for Haiti. And so I'd say we started this last November where we were just trying to be a megaphone of like, do you understand what's going on? We're very fortunate, and I won't talk too much about it because we're going to talk about it a little later, to have some of Ted's colleagues helping us tremendously with this voice. But one thing we're able to do with the Haiti Health Network is we've sent out some pretty detailed surveys of how do we measure the impact this is having on your ability to deliver healthcare. We have to be able to quantify this, and we have to be able to add some then qualitative stories with it, the emotional stories with it. And we've been able to do that. We've been able to, I don't have all the report in front of me, but we've been able to show that their supplies are down like 50%, their ability, their staff stress load is at an all-time high. All kinds of numbers we have to show how healthcare has been reduced because of what's going on in the country. Everybody's operating costs have at least doubled. I mean, all these different things, their ability to access fuel, to run a generator, we're able to kind of quantify how much time is lost. And so then we share these reports with anybody who will listen, right? Dr. Higgins, you know, UN, WHO, State Department, anybody. So we're trying to just get the word out about what's happening, and really we stay in our lane, how it's impacting healthcare, but it's drastic and lives are definitely affected. Another working group that we have is an administration and operations working group where we have leaders of organizations hop on a call, Zoom call once a month, where we share ideas. We ask for what kind of topics would they most be interested in, what topics would benefit their staff. And we do that once a month. And that usually is where we get a lot of ideas for our webinars and things, which I'm going to talk about in just a minute. Another great partnership we made early on was with the Haiti Medical Education Project. And I don't know if any of y'all are familiar with them, but they were started by some physicians here in the US, and they teach the Haitian residents around the country via a lecture series. It's every Wednesday morning at 8 a.m. And they were really struggling with some technology and stability issues. And so we as the Haiti Health Network said, okay, we'll partner with you. We'll run and manage all that and basically broadcast your lectures, share your lectures, and then we've been able to more than double or triple the amount of physicians in Haiti that are watching it. So it was a really great example of a partnership of what they were already doing. How can we come in and support? And Rachel helps run that every Wednesday, and it's been a great partnership. And I believe a lot of Haitians are getting to hear the knowledge every Wednesday morning at 8 a.m. And those are free, by the way, if anybody has staff in Haiti that would want to get on and listen, as long as they can get on the internet, it's there. And the topics, they vary, all different kinds of topics, from mental health to they did monkeypox to I look at the topics coming through, but every type of clinical topic goes through there. We've done some orthopedic surgery topics, basic ortho surgery, things like that. So it's very interesting, I think. And then, as I alluded to, we do host quite a few webinars. We try to do one a month. It doesn't always work out that way, but there's some examples of some that we've done recently with the topic of safety. We've done one on how to mitigate your organization's risk during these times, how to maintain operations as best you can despite all the difficulties. We've done some strategic planning. Anyway, all kinds of topics we do to help leaders of organizations. And sometimes we do these in English, sometimes we do them in French, sometimes we do them both. And in the past, we've also done a lot of clinical webinars. We've done like webinars on cardiology in Haiti or mental health in Haiti, neurology in Haiti. So different topics like that and those aren't necessarily clinical lectures. They're more on, let's get an understanding of who's all doing this service in the country and get together. So we've done those. Those are all recorded and on our website and online. And then as we talked about conferences and seminars, we're very excited to start getting these back. We actually are planning one in Cap Haitian for later this year. I don't know if it'll actually happen, but we feel very strongly about it. And we feel our Haitian team can totally pull this off without us being on the ground. So even if we can't go, which we probably won't, they can do it. And so we're going to probably keep pushing on and see if we can get these started again, because I do think they're really valuable. All right, last thing then, now that we've gotten through a few years of the groundwork, and this was kind of our vision, my dream all along, is then if we can show we know what everybody's doing, we can show that we've gotten to meet a lot of these people. We get to meet, I've had the privilege of being to so many hospitals around the country, meet so many incredible leaders. We have a pretty good handle on, if you want to invest in Haiti, where your most likelihood of success is. Where are the best facilities to work? What are some of the leaders that have had successes? And we're able to now work with some bigger organizations, USAID, some others, to then take the funding that they have and then disperse it in a more effective way. So I'll talk about a few of the projects that we've been able to launch in the past few years. This is one that the Dalton Foundation has funded. We are really passionate. Another story altogether, a lot of the businesses that fund the Dalton Foundation are related to medical equipment and that industry. So educating biomedical professionals in Haiti is one of our top priorities. We have a couple biomeds on our staff that are dedicated to this, but we launched a separate business, Haiti Biomedical Solutions, that's Haitian owned. Obviously put the seed money in. We're helping him start this business and expand it throughout Haiti, just because we think it's such a vital service to, we have a whole topic on medical equipment challenges in Haiti, but when you rely a lot on the donation model, as a lot of people are forced to do, you don't always get what you want and you don't always get what you need, and it causes a lot of problems. So we're working on changing that view as well. And this is a big piece of that for us. Equipping the caregivers is one of my personal favorite projects, and this was birthed out of an accident. This was birthed out of the data we were collecting. We were collecting all that data in all those departments, and one thing we learned was the absolute lack of basic diagnostic medical equipment in the rural areas. Our staff would go out to an area and they'd report that there'd be one stethoscope at the clinic, or there were 0 blood glucose monitors. Nobody has an otoscope, or and it was just a relative lack. I mean, I'm not talking necessarily in Port-au-Prince. I'm talking in the rural areas, but their ability to actually care for the people that came to them was so low. This was not on our radar of a project to do, but we realized it was such a need that we were like, let's get some people together to decide what these key items are. Can we put these kits together? What would be in them? Where are we going to get them? And so then we put the list together. We have a physician kit, we have a nurse kit, and then we have what we call a facility kit, which has a little bit more in it. And we put these together by the hundreds. I was able to get a lot of partners to donate pieces of the equipment, and then the foundation came in and purchased the rest. And to date, we've done about 900 of these kits in Haiti. We do it department by department. So we've done the North Department, we've done the Northeast, we've done the Northwest, and we've done the South. So we've done 4 departments so far. And I have about 250 kits we're getting ready to send down to the Grand Aunts on our next shipment. So it's a systematic project. Again, we're partnering with the Minister of Health and key partners in each region to get them distributed. And someone asked earlier a question about follow-up. I'm really big on follow-up. Everything we do, there's a form to fill out to get it. And then they know they're part of the WhatsApp group that's going to get the follow-up questionnaire. We do a 60, 90, and then a much longer follow-up to see what impact the kits are having. And these are my absolute favorite stories of doctors saying, the people now trust me because I can actually diagnose them, and just things that I didn't expect to hear, but were so interesting to be able to just give them the tools they need so they could do the job right where they're at, hopefully prevent people from getting worse to where they have to go into the city in a much dire state than they needed to be in. So that project's ongoing with the Haiti Health Network. The medical equipment modernization and standardization project, this is one we were kind of prepared to do from the beginning, but we kind of slowed it down a little bit once we saw the other need. But we are actively working to standardize medical equipment. The problem, again, if you've ever dealt with this, it's huge. Everything's donated. You have different makes and models of everything. The ability to keep it maintained and sustained is extremely difficult. So we're standardizing it and trying to bring in, like, for example, one project we did in 2020 was patient monitoring. We shipped down the same patient monitor by the hundreds, and we worked with the Ministry of Health to standardize all the facilities in the Northeast. And we've subsequently done that to most of the facilities in the North as well. And that's a really good project. We have our biomed in Haiti. He does the installation, he does the training, he does the follow-up. And that's a project that we're looking to expand around the country as well. And we've done quite a few other pieces of equipment too. Most of the work so far has started in the North because of our geography where our offices are located, and also the east to operate in Haiti. It's a lot easier, safer still to operate up there. But we are planning on spreading this throughout the country every month, every year, I should say at this point. It will be 2023 before we get down to the South. This C-arm project was actually birthed out of the August 14th earthquake last year. I think a few people have alluded to it. I'm sure Jim was probably about to go crazy then with how busy you were. We were very busy being on meetings and all the medical cluster calls, and everybody was talking about the problems they were having. How can we coordinate? We were constantly connecting people. One of the big challenges was getting the patients that were injured in the earthquake to a facility that had not only the personnel needed to take care of their injuries, but also the equipment to take care of the injuries. And so there was a definite mismatch. Some facilities had neither. Some facilities had great surgeons and people on hand, but they didn't have all the equipment. And then we found some places that had equipment, but there weren't any surgeons there, and they were a little further away. So we worked with a partner and a funder to then design a project to where we can bring some of this technology and equipment and strategically place it around Haiti. We've been working on this pretty intently in 2022, and by 2023, we should have this stuff positioned around the country. So God forbid, but when and if there's another earthquake, we hope that mismatch that we saw last year won't be nearly as bad. If a surgeon flies in, there's going to be 10 or 15 facilities that have this technology and this equipment for them to do their jobs. So we won't have to move patients around as much, hopefully. So that's that project. And then another project we launched this year was oxygen generation. As part of COVID, a lot of oxygen generation plants were brought into Haiti from various countries and in various states of repair. And we've been part of this project. It's been really exciting to help get them all well assessed as to where they are and their status, but also make sure they're functioning optimally. The numbers of barriers to getting them functioning optimally is incredible, as we learn, but we're just chipping away at them and getting them funded and operated so that Haiti can provide. The view is with all these plants, there should be oxygen available in every department for a reasonable amount of facilities so that just that level of care is increased from where it used to be. So this is a really exciting project that we're doing right now. And a lot of strategic partnerships. Gosh, I think we have about 300 now altogether. This is a picture of our guys delivering the midwife kits. This is one that Dr. Kaplan started up in Cap Haitian area, this and the Vitamin Angels project as well, that we've been able to continue and expand. This project is another one that has huge impact in the region to get these midwifery kits out to these facilities every year. We're able to distribute them to them, and every year it grows bigger and bigger. And we're really thankful for our partnerships with Direct Relief on that project, but it's a great one. And then lastly, I'm going to share a little bit about some of the lessons we've learned, and I think a lot of them have already been shared today. I don't think there's anything new about just that you have to just kind of do these things in order for these collaborations to happen as best as possible. That picture right there is just a great example of a collaboration. That was our last meeting we had in Lakai, where we distributed the Equipping the Caregivers kits down south. And again, we don't have an office down south, but through partners like Hope for Haiti, we were able to distribute, I think we did 400 kits down there in like 2 days, and they've been able to do the follow-up down there. So it's through all these partnerships that we're able to do these things. And again, I'm just going to go through some of these key lessons, but again, the collaboration is just so important. It never ceases to amaze me on the meetings that we have. The thing we learned is to be consistent. Somebody else said that today too. I remember Dr. Kaplan and I started these meetings, and early in COVID, we'd have a meeting every Monday night, and that'd be weeks I'd be like, oh my gosh, we're going to meet again. What are we going to do again? But every single time, something good happened, a good connection, a beneficial connection happened that was benefiting someone. I'm like, okay, I know why we're doing this. And more people, got interested in joining the meetings, and it's grown tremendously. Communication, obviously important. We do a lot of email communication. We do a lot with Facebook communication. Again, Dr. Kaplan started all that. That's very, very helpful. And I've already talked about consistency. Very, very important when you're leading a collaboration. And humility. Yeah, I always say this. We always get humbled very often in the work we do. So we stay humble, whether it's via Zoom or whether it's being in a meeting where we really have no idea what's going on, or whatever the case may be. With always staying humble and listening to all the people on the ground is so huge. And that's kind of what we view ourselves in. We don't do all the hard work that y'all are doing on the front lines every day. We're just here to organize it and support it. And it's a humbling role, but one we really love. I think when I enjoy hearing everybody's stories and seeing all the incredible work that's being done. It's been a real blessing. And that's all I have. Any questions?
Yeah, I just want to say a word about this Haiti Health Network, and Barbara and I'll talk more about it, but I just want to thank her for the opportunity of putting this together with Ted Kaplan as well. This has been a terrific group to have together, that we can, as medical providers, as healthcare providers, as people interested in Haiti, can get together, and it's a group that's really come together. And those meetings she talked about, you really need to attend. They are so valuable because you can hear everybody in the country. It's represented all over the country, and the impact that this is having on the State Department and the UN. I'll talk a little bit more about that, but is really significant. And so I encourage everybody to really get involved with this, with Barbara's group that she intended to put together, this Haiti Health Network. The meetings are excellent. All the different programs she talked about are right, spot on. Thank you.
Thank you, Dr. Higgins. We appreciate your participation. Everybody that participates makes the group, so it's that's what makes it great.
I actually, okay. I actually don't have a question. I just wanted to say that if it wasn't for Haiti Health Network, we would not have been able to feed the families in our community after the 2021 earthquake, because the lesson we learned after Hurricane Matthew was none of the major relief organizations, international relief organizations, were going to help us because they didn't. And so we ran our own feeding program for about 3 months, and then we had to discontinue it because we were going to go broke. And we have a birth center to operate. I mean, that's what we do, is run a midwifery center. But after the earthquake, because I was a member of the Haiti Health Network, I got connected with Project MediShare, and Project MediShare did send relief food down to us. And that was an even really a bigger boon than I had imagined, because at the same time, there had been organizations offering to help us with supplies, but they couldn't get them to us. They didn't want to fund the transportation. We didn't have the way to move supplies in bulk. And so Project MediShare said, we'll put the stuff on our trucks. And so we got even more food and more relief goods of other types that were delivered to us, all because we were a part of the Haiti Health Network. So just
Because all we do is host the meeting. They're all doing all the work. So
yeah, but that's how it's supposed to work. I mean,
yeah,
really,
we just bring everybody together so that you guys can talk and share what resources you have and then match. So.
And the only other thing I wanted to say was, you talked about the impact of all the conflict in Haiti right now on healthcare provision and capacity. And I mean, it cripples the providers because it's difficult to get goods and supplies. It's difficult to travel in the country. But our experience has also been, it makes it difficult for the patients to get to us.
Absolutely.
Because we serve a very wide, community. And since 2018, the cost of a patient the average cost of a patient to take a motorcycle from wherever they live within our zone of service to get to our facility is about 12 times more expensive just in the past 4 years.
Wow,
And
that's even more than I
half of
thought.
that increase has happened in just the last year. It's gone from about 50 goods per trip to 600 goods per trip. And that's a lot of money. That's twice what people make per day in that area.
Yeah, it's incredible. And it's numbers like that, Jim, that we're really wanting to share with people, because people don't really understand what's happening in Haiti and the amount of inflation. You hear, oh, there's inflation in Haiti. Oh, there's inflation everywhere. No. The inflation that we're experiencing is nothing compared to that. And the effect it's having, and trying to measure that and share that with people is one of our goals, because it's huge. The number of people dying from not being able to get into a facility, or once they get there, there's nobody there because they couldn't get to work. We're going to never know the number, but just from the stories we're getting, we know it's incredible, and it's tragic.
We got one more in the room here.
Hi, is this on? I just want to say this is like amazing work that is happening. I was born and raised in Haiti, and this is like really needed. My question is, can you share more about your experience with MSPP, like over
Sure.
the years?
I have nothing bad to say about MSPP. We have worked with them from the beginning. As Dr. Kaplan mentioned, Dr. Jasmine has been the director up in the north for quite a while, and he had an established relationship there. The employees that we have in Haiti had known him really well, and he has done nothing but support us in our work there. We provide him with a report every month of what we do. Obviously, we respect him and the work, follow the process. We go meet with him before we do things. He's been able to connect us in quite a few other departments. As we've branched out, and like I said, when we go to do the data, the very first thing our staff has to do is go meet with MSPP and get permission to do the work. We've never had a problem with that. So yeah, I don't have anything. Now, a lot of the bureaucracy of getting registered and all the things like that, they take a lot of time. Those things are a little frustrating, but I haven't had a bad experience.
I just can add to that. We have an HIV clinic that sees about 300 people at least a month, and the medications that we use are provided through the MSPP, USAID, but through the MSPP. And they were very instrumental for us to develop a relationship with the General Hospital in Port-au-Prince. We started working with residents, training residents out at our surgery center from the General Hospital with MSPP surgeons. They had appointed some surgeons to come out and inspect what we were doing and making sure that it was an educational experience for their residents back in 2016. So, you know, we've had a long-standing relationship as well with MSPP, and it has been good.
Yeah, we've always been real open with MSPP. Like we've had, even when I was at Mission Hope and we started a huge mobile clinic program, they're like, oh, we need to come and inspect that. And we're like, okay. So we had MSPP go on our mobile clinics with us for 6 months, and they loved it and they wanted to copy it in other regions. And same with all these projects that I talk about. We usually have an MSPP representative with us in the field. So they're watching us, and it's fine. It's all been good.
I have 2 questions coming from online. One, can you talk about the pharmacy program for Haiti through the Dalton Foundation?
Like a specific pharmacy program? I'm not sure the question on that. We are doing something that I didn't put on the slides, but we're working on right now. We're trying to find out what medications and supplies are most lacking in Haiti. We're never in favor of bringing things into Haiti that can already be purchased in Haiti, but we know with the given realities right now, things that used to be available aren't. So we're coming up with some lists. We know anesthesia is on the list, some paralytics, and some other key medications, and we're working to create like a buying group to bring some of that stuff in. I don't know if that's what they're referring to.
If they give me follow-up, I'll let you know.
Okay.
But the second question, oh, that's what she meant.
Okay.
Okay.
Yeah.
The second question is, does HHN have a list of recommended equipment, monitors, O2 concentrators, sonogram, X-ray, autoclave, that are best for Haiti conditions? Do you have a list of biomed techs available or the contact info of the business that you mentioned?
The answer to all those things is yes, but I can elaborate a little bit more. We have put together for most common makes and modalities a short list of usually 2 to 3 mics and models of what are the most Haiti appropriate. We have a list of criteria that our biomeds use to select that. Our US biomeds, by the way, have lived and have plenty of experience in Haiti as well, which is helpful. We always consider price, of course. We have to consider supportability. Will there be parts and things available for at least 5 years? If not, we're not going to deal with it. And then the ability to access it. And then, of course, it's durability in Haiti. And so we do have a list like for patient monitoring, for sterilization, for infusion pumps, in pretty much any category. We have a small list, ultrasound, X-ray, a list of what the best things that have been tried and true in Haiti. And they're also the things that we're standardizing to. The standardization thing cannot really be overemphasized because everything breaks. People always say, wonder if it breaks. No, it will break. It's just a matter of, will you have a part available? How long will it take you to get the part? Does somebody in the country know how to repair it? And if we can standardize things, and this is what we're doing, we just got another grant. I didn't talk about that, but to set up a training center in Haiti, and it will have anything that we're standardizing will be stocked in there with all the accessories and spare parts so that when these things break, we can repair them in a much quicker way. Example is that C-arm project. So we're bringing in the same make and model throughout the whole country. We're going to have the extra ones in country with all the key parts that, you know, the first fail parts, they call them. What would those normally be? Have those in country. And we've even had other organizations reach out to us that weren't part of the first phase of that program saying, hey, we want to buy that same CM. Whatever you're putting around the country, we want to buy it because we know you have people that can repair it and service it. And so that standardization model is really important for sustainability. You're welcome.